So, good evening, everybody. Welcome to the webinar. My name is Scott Lucy. I'm the Business Development Director for Duolife in the UK and Ireland. And I'd like to start by giving you a brief background with regards to Duolife's association with the World Healthy Living Foundation. Duolife is the founder and funder of the foundation since its inception back in 2015. The foundation promotes education in the field of healthy living, inspiring individuals to take good care of their health and improve the quality of their lives. And we'd love to hear from you if you're joining us this evening, and let us know where you are in the chat, which city, which country you're in. That would be great. So as you can see, the foundation has been in existence for 7 years, and with the support of our experts, the foundation communicates through a variety of educational solutions, including publications, lectures, and practical classes. You can contact the foundation through our Facebook pages, and you can follow us on Instagram. So it's my honor and privilege to introduce to you our expert speaker this evening is Dr. Dorian Dugmore from England. Dr. Dugmore is the founder and CEO of the Wellness Academy. He has a PhD in cardiovascular medicine and is recognized internationally as an expert in cardiovascular health, preventative medicine, and wellness. During his long and impressive career, he's initially played and then coached football internationally. He's run 26 marathons, was the program director for the world-famous Toronto Rehabilitation Center for recovering heart patients, and he built the award-winning Adidas corporate wellness program, as well as Fit for Manage program for football managers, and served as the nucleus for sport cardiology in Europe. His wellness programs have achieved both national and international acclaim, and just this week, he's received yet another award. So we're very, very excited to welcome you again this evening. Dorian, please give us your best presentation on the subject you know very, very well. Over to you.
Thank you very much, Scott, and good evening, everybody. Look forward to chatting to you for the next 30 or 40 minutes. So the topic for tonight's webinar is called Exercise is Medicine. And when we look at the benefits of exercise, we can look at different parts of the body and the systems in the body that benefit from regular exercise. And the first one is the heart. The heart obviously is the pump that circulates oxygen-rich blood around the body and to all the muscles and all the systems in the body. So it's the gas or the petrol of your life, and keeping it in great shape is very important, and exercise does a great job at doing that. If you exercise regularly, there are lots of changes that happen to the heart. The first one is that the power of the heart as a pump increases. And so people that exercise regularly will find over time that their heart rate gets a little bit lower because the strength of each contraction, each pump or each heartbeat increases significantly. And because of that, the amount of blood that the heart can pump out every beat, it's called the stroke volume. That's the, if you like, the physiological or clinical name for it. The stroke volume increases as the heart improves its fitness. And when you multiply the number of beats your heart makes every minute against the stroke volume, the amount of blood that it pumps out, you get a thing called cardiac output. And that actually improves as well when you get fitter and healthier. And so the heart is really, really important in terms of supporting exercise and changing in terms of its health and functionality with regular exercise. One of the most important things around the heart is the muscle itself. The clinical name for it is called your myocardium. And what happens is that the main three arteries in the heart, called the coronary arteries, they're the A roads of blood supply to the heart muscle. And one of the absolute best benefits of regular exercise is to increase the number of B roads or smaller tributary parts of the circulation around the heart muscle. And when that happens, that's called your collateral circulation. That is vitally important because why? It means that your heart is getting a regular amount of blood and a good blood supply through to every part of the heart. And that could be quite critical, particularly if you have a blockage in one of the A roads, the main coronary arteries. Then if you've got lots of B roads, the oxygen-rich blood can navigate around the blockage in some circumstances and be the difference between survival and not surviving. So that's the heart. Then we're looking at the muscles. And when we look at the anatomy of the body, then muscles cause movement, and those muscles have to cross joints to precipitate movement and cause activity. So keeping all the muscles in the body in good shape is actually critically important as well. But here's the other important factor about muscles. You have a regular blood supply into those muscles. And with regular exercise, particularly with both aerobic exercise, that just means exercise in the presence of oxygen, and strength type exercise, that's weightlifting or moving weights or resistance training, which is probably a better word to describe it. The circulation within the muscles actually increases. It's called your peripheral circulation. And it's a little bit like the heart in that you've got major vessels or major arteries that go around the systems of the body and into the muscles. But if they generate lots of extra B roads that we talked about with the heart, the same principle really is related to the muscles, then you get lots of good circulation into the muscles themselves. And that keeps the muscles very, very healthy. Now, there's a thing called AVO2 difference, and that stands for arterial, oxygen, and venous difference. And what you don't realize very often about exercise is that oxygen that travels in your blood goes into those muscles, and then the oxygen is used as a source of energy by the muscle cells themselves. But much of that oxygen can actually come back in the veins. So when we look at arteriovenous oxygen difference, or AVO2, what that's really doing is saying, what is the difference between the amount of oxygen in your arteries that carry blood from the heart to the muscles and any, if you like, extra oxygen that can't really get off and work into the muscles that comes back in the veins? And clearly, the better your circulation, the more of a peripheral circulation you've got, those extra B roads in the muscles, the more bus stops there are for the oxygen to get off and give the muscles energy. So a regular exerciser will see significant improvements in their arteriovenous oxygen difference. And that's so, so important. So the muscles and the heart are vital in terms of the effects of exercise as you get fitter. So that's very, very important. Also, the brain changes if it's exercised. Now, if the brain is exercised regularly, then it will use and develop more of the brain connector nutrients in the brain, things like serotonin, the brain connector, between each of the cells in the brain. And as the brain's exercised, then it will start to develop all the good chemistry that the brain needs to work effectively. And the other thing that happens with the brain is that because you're exercising regularly, it helps to develop those good nutrients, and any inflammation that could occur with the brain, if you're particularly stressed, for example, or very anxious, then those nutrients will improve and fight off any inflammatory effects in the brain. And so exercise is actually good for the brain itself. and we should all really realize that and make sure that that makes a difference. So if we can move to the next slide. So keeping your brain active is very, very important. And so making sure that you challenge your brain, particularly as we get older, is critical. And so learning new things, learning a new language, as we mentioned before, learning a new instrument, doing something that generates challenges for the brain will then increase the nutrients that the brain needs and all the connector chemicals in the brain that make a real difference. Things like serotonin, the brain connector we've mentioned, oxytocin, the love chemical, DHEA, the anti-aging chemical, they will all increase by challenging the brain. And so in terms of exercise, physical exercise is good for helping the brain connectors increase, but also challenging the brain is very, very important in terms of keeping yourself in shape. So what are those benefits? Well, reducing inflammatory cytokines in the brain that can cause problems, and that can help to contribute against the risk of developing premature dementia, and also premature heart disease and many cancers. So exercise has the effect of stimulating the good chemistry in the body that helps you fight off those challenging diseases. And it's so important to realize that. Now, this is a typical example. This is a company I've been working with recently. And if you look at the slide on the right-hand side, you can see green, yellow, and blue components of the slide. And what we did to start with is we actually asked how ready the people in that company, some 50 to 60 of them, were to exercise on a regular basis. And 9% of that company were thinking about regular exercise, but not doing it. Another 9%, were ready to exercise. It was very imminent. They bought the best pair of trainers. They'd, got a super tracksuit. They'd joined the gym, but they'd yet to start exercising. And then 7% of them in the action stage, had been exercising for 3 to 6 months. 27% had been exercising for 6 to 12 months. And nearly 50% had been exercising as part of their life for up to 5 years or more. Those are very, very good results. If we look at a general population, then we can probably say that still 80% of that population are relatively inactive. It's a major, major issue. Now, the government would suggest that you need to exercise for 2.5 hours every week to get some benefits. That's true, and probably more, if I'm honest. But the latest research suggests that even walking for 20 minutes can actually have some benefits on your health, improve your sleep. Just that protective factor can be vitally important. And people need to realize that exercise is so protective for cardiac disease, reducing cancer, and diabetes, because it's burning up the sugars that can become rife in your blood and cause things like diabetes. So exercise is very, very important. Another important thing to realize about exercise is that the benefits of exercise can't be saved for later. You lose the effects of exercise certainly in 4 to 6 weeks. The benefits are very quick to disappear and not be as effective. If you look at your muscles, then the benefits of exercise on your muscles, in terms of your strength and endurance of your muscles, they can disappear in as short a time as 2 to 3 weeks. So you cannot store exercise. It's a current account. What you were as a great athlete 10 years ago will not be of benefit to you today. However, in all honesty, if you have been active, for a long period of time, but now it's some years ago, you'll get those benefits back probably a little bit more quickly. And so it becomes very, very important to exercise on a regular basis. When we look at all those factors and we relate to people being active and full of energy, 80% of populations worldwide probably die prematurely due to disease. And 80% of those diseases are what we call lifestyle-related diseases. They're diseases we can have some choice about limiting the risk of them if we take care of our health and well-being. So that really means that probably only 1 in 10 of us are living the life that we should really expect to live. Okay, I'm going to talk to you now a little bit about what happens when you're exercising. What happens to your heart and lungs, what happens to your body chemistry when you're exercising. Now, as you view the screen there, you're looking at a graph, and I want you to imagine you're on a treadmill. And on the treadmill, I've wired you up to electrocardiograms, which is my expertise as a cardiovascular specialist. So I've wired you up to an electrocardiogram. I'm asking you to wear a face mask or maybe a mouthpiece, and I'm collecting how much air you're breathing in and out, and what is the percentage of oxygen in that air. It's about 21%, and that we get from the air we're breathing in and out. And I'm actually going to measure that as you're exercising on that treadmill. So the green part of that graph, imagine the treadmill changes in terms of its speed and its elevation every 2 or 3 minutes. And to support that exercise, you need more oxygen. And to use more oxygen, and on the vertical scale, VE means how much air you breathe in and out. HR is your heart rate. And CO2 is how much carbon dioxide as a waste product you're getting rid of when you're exercising. So what happens when you're exercising in the green? Well, the treadmill every 2 or 3 minutes is getting faster and a little bit steeper. So you need to breathe in and out more vigorously. Your heart rate needs to pump a little bit more rapidly, and you need to get rid of carbon dioxide as you're using oxygen to support that energy that you need for exercising. What does the green mean? The green means supply meets demand. So very simply, by increasing those things on the vertical scale, you're able to use more oxygen on a regular basis. That's called aerobic. And that's all that aerobic means. I mentioned it earlier. It means exercising in the presence of oxygen. And then there's a break point. And your ventilation and your heart rate and the amount of carbon dioxide you produce goes up disproportionately to how much oxygen you can use. And that's called your metabolic threshold. It's at about 50 to 60% of your capacity. What does it mean? It means that now you're starting to produce some waste products in your muscles, and the most common one that you all probably heard is lactic acid. And lactic acid is tightening up time. You can't get too much lactic acid in your muscles, else you're going to have to stop. And then you start to breathe more heavily during the blue zone, more air in and out, heart rate pumps faster, CO2, you try to get rid of more of it, and you need more oxygen. And there's a second break point at 70 to 80% of your capacity. That's called your ventilatory threshold, VT. And that's when I can really hear your breathing. And finally, you get into the red zone, which is called anaerobic. And anaerobic means that you just cannot possibly produce and generate enough oxygen to support the exercise you're trying to do. The treadmill now has got faster and steeper, and very shortly, usually in about 2 to 3 minutes, it's rigor mortis time. You're not going to be able to carry on forever. And so that is high intensity exercise. And when you look at the best place to exercise, it's probably in the blue zone. And that's somewhere between probably 50 to 70% of your capacity. That's the safest place to exercise. If you're going to go into the red zone, then you better be fit enough to do that, because to sustain exercise there for a long period of time takes a lot of motivation and, of course, a lot of energy. So that's explaining what happens when you're exercising. Now I want to tell you some really important things about exercise when we look at prescribing exercise for people on a regular basis. The coronary circulation, which is the circulation around your heart, I mentioned it earlier with the B roads, the collateral circulation. When your heart beats rapidly, it squeezes and then fills. It squeezes and then fills. That's a heartbeat. Now, the part when it fills is called diastole. But the part when it squeezes compromises your circulation around your heart a little bit. And so consequently, when you exercise at a very high heart rate, how much time is there for effective blood supply to go around the heart? Not so much as if you reduce the tempo of the exercise, so your heart rate drops and there's more time for each heartbeat to recover as we go through the exercise. That's why interval training is a good way to train safely. And what does it mean? It means, very simply, you exercise at a certain intensity for just 2 to 3 minutes, and then you drop down that intensity, so your heart rate drops, your blood pressure drops. There's more time for blood to flow around your heart, and it's a safe form of exercise. Now, compare that to HIIT training at the bottom of the slide. That's high intensity exercise when your heart rate can be beaten at very, very fast rhythms and rates. How much time is there for good circulation of oxygen-rich blood around your heart? Not so much. It's fine if you're fit enough to do it, but if you're not, potentially it can be dangerous. And so using interval training is a good way to train. Training improves then every 4 to 6 weeks. So every 4 to 6 weeks, you will see an improvement in your fitness. If you start from a very low level of fitness, then you'll see significantly large improvements in fitness. But if you're already fairly fit, the improvements will be smaller, but very qualitative. Now, we've moved on to exercising the body regularly with weights. And that is also critically important. For your muscles to move, they have to cross a joint. And the way they cross a joint is through a tendon, because a tendon attaches muscles across your joint into an area the other side of the joint. So let's take your biceps muscle. We all know where our biceps is, and people train very often to get bigger and stronger biceps. But the insertion of the tendon is actually in your forearm. So it crosses the elbow joint. And at the other end of your biceps muscle, it crosses the shoulder joint. So muscles cross joints through tendons. What are some of the benefits of strength training or resistance training with weights? Well, the first benefit is it improves the circulation in the muscles themselves. The second benefit is it increases the endurance of muscles. Now, if you use heavy weights, the size of muscles will increase. But if you use light to moderate weights, the circulation and endurance of the muscles will increase. The appearance and tone of the muscles will benefit, but they won't necessarily get bigger. So it's a misnomer to think that just using some weights is going to make you have bulging muscles. Very often when I work with a lot of women, they are concerned about bulking up their muscles because they're using weights. If they know how to train properly, and use lots of repetitions with relatively lighter weights, then they'll have good toned muscles with great shape without them being great big bulging muscles. But here's the other benefit of regular resistance training and strength training. When a muscle crosses a joint through a tendon, that tendon is inserted into bone. And when it pulls on bone, it encourages the influx of that sort of marrow bone jelly type substance inside the bone that keeps the bone very, very healthy. And we've all heard of probably a disease called osteoporosis. It's often called brittle bone disease, where the bone itself suffers from a lack of nutrition, a lack of that jelly that keeps it nice and healthy inside the bone. And guess what? Resistance training and weight training encourages that special jelly-like substance to keep itself in good shape inside the bone and keep you very, very healthy indeed. That's why a good exercise program has both the cardio element to it, the endurance element, you know, the running on the treadmill, the walking, the cycling, the swimming, and a resistance training or weight training element that uses weights or even just your own body weight with local muscular endurance like push-ups and sit-ups and local muscle activity that just really uses your weight. Both of them are critically important. And surprise, surprise, the older we get, the more important resistance training and using weight training alongside your cardio training is very, very good indeed. And so both of them are important. So how hard, what's a good guideline to give you some, you know, help on looking at the intensity of exercise? This is called the Borg scale. And the Borg scale it uses a thing called perceived exertion. And it starts at 6 or 7 for very light exercise. Don't ask me why it starts at 6 or 7, but it does. And it goes from very, very light to very light exercise at 9 to fairly light exercise at 11 to exercise that's somewhat hard at 13 to exercise that's hard and then very, very hard at 17 and very, very hard at 19. Where do you think HIIT training is? HIIT training will be down towards the 17, 18 and 19 end of the Borg scale. Where do you think just a comfortable walk is? Probably 7 or 8 at the very light to very, very light end of the scale. So where do you think is the ideal rating for you to get some benefit of exercise without really killing yourself? Probably 12 or 13. Somewhat hard. How do we know physically if we're getting some benefits? Well, I'm going to give you 4 or 5 tips that tell you if you're getting enough benefit from exercise and all the sort of medical benefits that go along with it. Number 1, you're conscious your heart's beating faster. Number 2, you can probably hear your breathing. You're not breathing so hard that you just can't carry on, but you can hear your breathing. Number 3, you're conscious there's a temperature change in your body, so you're beginning to sweat. And number 4, you can still talk. You can't recite your thesis or your favorite book, but you can hold a conversation, but not an extended conversation. If you remember those 4 things, then despite all the medical evidence and clinical evidence I've talked about earlier, you're pretty much going to be at 12 or 13 on the Borg scale. Where's that in the graph I showed you? In the blue zone. What sort of intensity of exercise is it? Between, well, it's around moderate exercise, a little bit hard. So there are some really good guidelines for you. The latest trend now is to wear, they're called wearables, exercise wearables, is to wear a device that can monitor your heart rate, that can actually monitor your steps, that can, in some instances, help monitor your energy consumption, give you guidelines about your oxygen usage. There's a myriad of them now in the marketplace, and they vary. And there have been studies that have looked at the reliability of them, and they can very often differ. But they are a good thing to use, and I think their major benefit, as well as giving you some guidelines on the physiology of your body as you're exercising, it keeps you good. It keeps you tracking and monitoring the exercise that you're doing. And for me, that is a major, major benefit, because it's keeping you realizing you need to engage in some physical activity. So that's a major benefit. So if you're exercising at moderate intensities and getting some benefits, you will be on the right-hand side of the emotional landscape. And those that have listened to me before, when I talked about stress and resilience, then that's the right-hand side of the emotional landscape. What sort of things are released when you're on the right-hand side of that landscape? Well, they're called endorphins. I mentioned them earlier. Oxytocin, the love chemical, DHEA, the anti-aging chemical, serotonin, the brain connector. They all get produced and increased when you exercise moderately. Compare that to really high intensity exercise. Actually, you can produce too much adrenaline, too much cortisol, which are the stress hormones. So the best benefit of moderate exercise is to actually build some resilience on the right-hand side of the emotional landscape. So that's so important. If we move to the next slide, this is a little bit of fun. And very often when I talk to populations about regular exercising, then these are some of the categories that I have some humor and a joke about. And the first one is the exercise-free zoner. That's the person that keeps away from exercise and avoids it like the plague. So that'd be the person that's working out on the Stairmaster, or calls it the treadmill. So that's a person who, when they feel the need for exercise coming on, they lie down till it goes away. And then you've got the yeah, but exerciser. That's the person that has good intentions, but I was going to start today, but it's raining. Oh, yeah, I'm going to exercise, but listen, I didn't realize the time has just flown by. I'll have to do it tomorrow. That's the yeah, but exerciser. What's the hard slog exerciser? That's the person that exercises, but doesn't really enjoy it. It's the sort of treadmill, Stairmaster type of exerciser. They do it, but it's painful and they moan about it. And that's the hard slog exerciser. What's the Energizer Bunny? That's the person that's over the top with exercise. You know, that's the person, all their friends are exercisers. All they ever talk about is exercise. Socially, when they go out, it's all to do with exercise. They don't go anywhere where there isn't some exercise involved. And that's a sort of highly intensive, over-the-top exercise that can be too much sometimes. Yes, it is hero. That's a fun one. That's the person that looks in the mirror and they've put on loads of weight and not in good shape, and they think, wow, but I hadn't used to look like that. And they imagine themselves as they were 10 years ago when they were in good shape. That's yesterday's hero, but they want to get it back. And that's why they keep looking in the mirror. And what's the never again exerciser? That's somebody who's had a bad experience with exercise enough to turn them off for life. And like the personal draining there that we're joking about. So much fun looking at these people. And when I speak to large audiences, I ask people, which one are you? And so we can have some fun and light-hearted approach to exercise. So what do you do in terms of regular exercise? Well, the first thing you need to do is give yourself some permission to change your life. Stop limiting yourself and realize that just by engaging in regular exercise at a very light to moderate basis is a good thing to do. Don't stop yourself. Just make sure that you give yourself permission to change. That's so important. So if we move on to the next slide, the new medicine is focused on what happens between visits to the doctor. It's actually what you do between getting assessed, getting your fitness checked and tested, having your key numbers measured, as we did with Duralife last weekend when we opened the new offices. They're all great, but it's actually what you do about it that makes the difference. And that's so important. And remember, if you've been a professional sportsman, that doesn't even guarantee immunity from the effects of not exercising and not keeping in shape, especially when it comes to heart disease. And I've spent the last 14 or 15 years working with some of the professional football managers in all of the football leagues. And some of them get in trouble when they switch from being a player, which the majority are, to a manager, and their lifestyle changes. You know, they don't always eat healthily. They have long hours. They maybe drink a little bit of alcohol too much on occasions. They don't exercise. And as a result of that, their health can be compromised. So remember what I said earlier, just because you're a fit person 10 years ago, that's not going to be cardio and cancer protective today. So you have to keep practicing the exercise. And there are some great examples. You probably recognize this player. Is a footballer, very famous, called Maradona. And at the height of his career, he was a fabulous footballer. However, a few years later, if we look at the next slide, we'll see that's what happened to Maradona, because he fell off the wagon in terms of regular exercising. He was eating too much food, and there were other things associated with him that were bad habits. And you know what? I spoke to his cardiologist in Cuba when I was having the privilege of speaking on heart health in Cuba, and they said that his ejection fraction of his heart, when he was at his worst, went down to 19 to 20%, and it should be 50 or 60% or slightly more. So even legends like Maradona, if you don't look after yourself, then you can't store exercise. And so important to realize that. There's some very famous research on 2,000 people back in the sort of almost over a decade ago, looking at studies on them over 8 years, published in the Annals of Internal Medicine. And to keep themselves in great shape, they had certain characteristics, and they were not smoking, looking after their weight and making their body mass index no greater than 30. And your body mass index is your weight in kilograms divided by your height in meters squared. So it should be less than 30 for both men and women. So they looked after their weight. They had a minimum of 3.5 hours worth of exercise a week. And in all honesty, the government guidelines of 2.5 hours of exercise are probably not enough. Probably 3 to 5 hours of exercise is what we really should be aiming for. And they ate plant-based foods, whole grains that are very, very heart healthy and cancer healthy, and lots of fruit and vegetables. And if they had meat, it was probably more like white meat and chicken or turkey, and it was probably limited. And when they followed a lifestyle like that, what happened? Well, the next slide will show us that there was a 50% reduction in all causes of premature mortality and death. 93% of them didn't get diabetes. Heart attacks were down by 81%. Chronic disease, inflammatory disease was down by 78%, and cancer down by 36%. Well, if we could put that in a pill, we'd all buy it. But they have to invest in looking after their lifestyle, and exercise is a big part of that. And in the UK, a lack of exercise is up there now as a risk factor, with alongside smoking, too much alcohol, and a poor fatty diet that can give you a premature rise to obesity. And it's now a major, major problem in the United Kingdom. We are one of the most obese countries in the world. And so we really need to promote exercise. Why? Well, I think we've already justified the fact that it improves muscular strength. It improves your immune function. It can fight off diseases that can cause major, major challenges. And exercise over time, particularly moderate exercise, promotes the development of antioxidants. Because when you exercise, oxygen breaks its bond and forms things called free radicals. And so to neutralize free radicals, you need to supplement the exercise you do with the things we'll talk about towards the end of this presentation, which we've nearly sort of come towards an end of now. So next slide, if we can. Some tips on helping you exercise and keep up with regular physical activity. And the first tip is to make an appointment with yourself in your diary. That's one of the biggest tips I give people when I encourage them to exercise. You make appointments for everything else. Why not make an appointment for yourself to exercise regularly? The second good tip is to keep a track of your workout. You can monitor things like your heart rate, the amount of time you exercise, the mood you felt when you're exercising. Did you enjoy it? Was it really over the top, or was it comfortable and you really had a great day exercising? So keeping track of your workouts and what you find out about them. Getting an exercise buddy, getting somebody to exercise with. You know, the amazing thing about that is if you make a commitment to meet somebody to exercise with, you're more likely to keep to that commitment and exercise regularly. So that's a really good tip. Try and find an exercise you enjoy. You know, if you find that you're the never again exercise that we joked about earlier, then try and find something that you can really say you enjoy. And walking is great. Yoga is great. Any exercise, to be honest, is going to have a benefit. So try and find something you enjoy. And practice a variety of exercises. Don't just stick to one thing. Vary it. So aerobically, can be walking, can be jogging, can be running, can be cycling, can be swimming. For the strength and flexibility type exercises, it can be things like yoga, things like Tai Chi, things like strength and weight training. So a variety of exercises is so important. And coming towards the end now, set yourself an exercise goal. So have something that you're working towards. Maybe it is that 5K. Maybe it's doing an event with a friend. But have a goal that you work towards that can really motivate you to exercise. And last but not least, know your numbers in terms of your overall lifestyle and health. And we did that last week at Dual Life offices, where we measured key numbers of a lot of people that were there. So they had a profit and loss account of their own health and well-being numbers. So important. This is a very famous study, and I'm almost finished now, but this is the Life Fitness study. 70,000 people studied over 70 years. And he had three groups. The typical group that as they age from 35 to 85, what happens? You go down the tube. That's what happens when you get older, isn't it? Then he has a group that humorously called the pessimistically optimistic. Those say, well, you know, if we exercise a bit and we look after our diet a bit, you know, we can probably delay the effects of aging, but we'll go down the tube. And then he had a group that exercised for at least 3 to 4 hours a week, ate a healthy, balanced Mediterranean type diet, managed their stress in their life, and looked after their weight, and they only lost in their 80s between 10 to 12% of what they had in their mid-30s. So is it mandatory that you go down the tube as you age? No, it isn't. And what's the difference between the typical and the ideal? It's a thing called quality of life. And that's what we all should be working towards. So finally, some of the products that we can take that can be tremendously beneficial for exercise. Dual Life Day and Dual Life Night. They can provide a myriad of essential vitamins and minerals that you need to support your exercise during the daytime. And they can promote the production, particularly of antioxidants, that can really fight off those free radicals and those things that can really lead to problems with plaque inside your arteries, many cancers. So vitally important. But what you then need to do is to be able to recover, rejuvenate, and repair Dual Life Night. And all of the wonderful minerals, vitamins, fruits you can see there are going to help you recover. And remember that during your sleep, cells repair themselves. And that's when cell rejuvenation happens during sleep. And so Dual Life Night is a great, great supplement to take. And remember, there are only 25 mils, a shot glass full that you need to take. So important. Chlorophyll, essential. I mean, antioxidants in your body, they stimulate. And I mentioned before, when oxygen bonds get broken, you get free radicals. What will chlorophyll do? With those things that are listed there, alfalfa, mint oil, chlorella, then they will help produce and stimulate the production of antioxidants. So important to fight off disease. And finally, next slide, Dual Life Vita C. Vita C is really, really important for promoting immune function and so critical to fight off particularly viruses and infections. So Vita C together with the next slide, which is Vita C powders, again, for immune function, critically important. I hope you've enjoyed the presentation today that's talked about exercise. One of the things that will happen with exercise is if you do it too intensively, it will challenge your immune function. So Dual Life Pro Lumino is really, really important to take as a supplement along with regular exercise, because that's going to help bolster your immune function and really help you to enjoy your exercise and get maximum benefit from it. We've come to the end of our presentation now. My last slide is my blood. And one of the things that your blood needs that is critical is all the essential B vitamins, and they're all listed there, together with vitamin A, D, in particular, and vitamin E, vitamin C we've mentioned already. All of those are in abundance in my blood. And so if we're looking at a list of supplements that are going to support us during exercise, we've just been through them now. So I think we're there at the end of the presentation. Thank you so much for listening to me. I hope you've got some insights into the world of exercise and the right ways to support it. Thank you for listening to me.
Oh, Dr. Dugmore, thank you so much. And fascinating, absolutely fascinating. I've realised that I'm somewhere between yesterday's hero and an Energizer bunny, but I'm not quite sure where. I returned to the gym today after about 4 weeks break because I had a pretty bad cold, and I'm really feeling it. You're right. It takes, 4 or 5 weeks, you've lost it, right? And you've got to start again. I've really noticed it, so I'm a bit sore. But absolutely fascinating presentation this evening. I really thank you for doing that for us. And I think we're going to hear another one from you in next month, aren't we, in March?
Yeah, I think sleep your way to better health, I think is the...
Okay, that sounds more like me.
Yeah.
But also to mention on Saturday the 23rd, for those of you who didn't come to our last presentation in Milton Keynes last week with Dr. Dugmore, he's very kindly offered to come back and do some more Know Your Numbers. So, make a note of that in your diary. We have usually around 6 or 8 people, I think last week we actually analysed, didn't we? It's fascinating
Yeah, well,
information. And, one of the other things that I want to just mention before we close was about the protein shake, because obviously in the gym, protein's important. I was speaking yesterday with a professional basketball player, and he said that he's really, really enjoyed using our protein shake. So I would probably add that one into the list as well. But
you'd be spot on, Scott, because when you resistance and weight train, your muscle fibers get broken down, and because they're essential protein, so the protein shake will help repair.
Yeah, and well, we've had a lot of people commenting this evening. Monica said the heaviest weight at the gym is the door handle. I really relate to that. and, but a lot of people participated tonight. Really, really exciting evening. I'm so pleased that we've recorded it, because I'm sure we're going to be playing this again in the near future. So there we go. We'll be hearing from you again next month, and I'm sure we'll be seeing you at our events as well. So all the best to everybody. Thank you all for joining us. And thanks once again to Dr. Dugmore. Please look us up on the World Healthy Living Foundation. The website there is being flashed on and off. And if you get stuck with it, you can always write to us at the office. So thanks so much, everyone. And we'll speak to you very, very soon. Take care. God bless. Bye-bye.